When we talk about blood, and in a pathological sense, it will be a blood deficiency that would happen. There's 3 organs that are involved in blood production or making blood in our body. So the liver stores blood, the heart governs blood, and the spleen makes blood. Now, those things are similar, but not exactly the same. So the main difference between the spleen and the liver in that sense is the spleen making blood is through the digestive processes of the spleen, so the transformation and transportation of food and fluids. So you've got to have some substance to make blood out of, right? Remember, blood is yin in its density kind of form, right? It's a liquid, it's a substance that's got to actually be made out of something, so it's got to be made out of food. And then the liver itself is how that helps make blood, or that's why we use that word storing blood, is through sleep. So regenerating and rejuvenation. Now, when you're asleep, your body's doing all of its repair processes in the body, and that's where the use of blood comes in. So blood nourishes things, right? So you can see a person has blood deficiency. One of the symptoms they might have is like dry skin, dryness in the skin, because blood is a nourishing thing. Like the blood has to get to that area and moisturize it and nourish it. But also someone could have very pale skin, right? Because a lack of blood goes there. So, you know, when someone's had a severe fright or a shock or something like that, and they've got a lot of adrenaline rushing in their body, they might suddenly go very pale, like white, ghosty. And you might see this, you know, you see that in old-fashioned movies where women are about to kind of pass out and they're looking all pale and ghosty because of a lack of oxygen, right? And that's to do with blood, like lack of oxygen. Like this, in the old days, they had the corsets, which were so tight around the diaphragm, they couldn't actually breathe properly and they'd pass out really easily because of that. And that going pale, so blood carries the oxygen. So part of blood is yin, part of blood is yang. So blood that's just, there's no life in it, blood that's dead is all yin. But the blood that we need in our body is yang, because it's got the life, like the life blood, the life force. It's warm, it's which is a yang aspect, and it's like it's kind of moving there. Anyway, so the liver stores blood. What does that mean? It means that aspect relates to the rejuvenation of our body at night time. So it's very much related to sleep, and that's why when you see patterns of liver, so if you're learning Chinese medicine now, you'll do foundations, and then you do pathology in Chinese medicine. You start learning about liver blood deficiency, and that's why it's got a big relationship to sleep. So if someone has insomnia, certain types of bad sleep leads to blood deficiency, because your body can't rejuvenate, it can't store. So there's this saying in Chinese medicine, like when the person lies horizontal, the blood returns to the liver. So when you're sitting, the body's like semi-active, let's say. So you have blood flow in your limbs, you have blood flow definitely to your head. If you're doing a lot of stuff, you've got blood flow there, right? More blood flow goes to your limbs. Should I need to run away, or should I stand up? I have more blood flow in my limbs. But when I lie down, it's like more blood flow can come back to the organs, which is hence why if you're a person that travels a lot, let's say, that's a good example, like you're sleeping on planes, and you never get a great sleep on a plane because you can't lie down flat. And so it's your body just can't rejuvenate itself as well as it would had you just simply been lying down. Power naps and stuff are useful to have in the day, but much more beneficial if you can lie down flat, lie down, rather than just slumping over, or, you know, lying on slumping over like that, or sleeping in a chair or something like that. So that's the aspect of storing of blood. That's what the liver does. The second aspect of storing of blood is it regulates the menstrual cycle. Now, part of the wood aspect of our body, which is more the qi or the gallbladder aspect, is that regulation of cycles in general. And in TCM, they kind of put this aspect to like as a function of the liver, the regulation of qi. So that movement, right? So that spreading outward movement. Every organ has a direction of movement, or a flow of how, direction of how it's flowing. And the wood direction is in this 4 ways kind of spreading. And that's a much more of a qi aspect or a yang aspect of wood than a yin aspect of wood. So purely like the liver is a yin organ, So it's more relates to blood. What does the cycle, like we go back to the menstrual cycle, regulating the cycle, one is you need qi, like that regular flow of qi to do that. So if you get liver qi stagnation, you get a blockage of qi, you get a late cycle, or you could have like painful periods or lots of blood clots. So you could start out with qi stagnation, and that leads to blood stasis, blood stagnation. But the blood aspect of the storing of blood, the yin aspect of that and the menstrual cycle relates to actually having enough blood to make a period. So someone that's got blood deficiency might have amenorrhea, which means they don't have a period, they don't have a proper regular menstrual cycle. And so the liver's got that function of storing of blood relates to like having blood to nourish the areas that are needed in the body. So we'll come to that when we come to sinews. It kind of has that relationship there as well. But certainly this is a big one for women because of the menstrual cycle, right? So if you have a regular menstrual cycle and you've got enough blood, you have a proper period, let's say you had a perfect period, then you could say that function, that's a reflection of healthy functionality of the liver in that aspect. One is of the storing of blood, and secondly is in the regulation of qi, or ensuring the smooth flow of qi, as Giovanni puts it. Why do women get more easily blood deficient than men? Well, because they have a menstrual cycle, there's more of a chance for you to lose more blood. And how do you get blood deficient? Well, one could be because you don't have good sleep. Another way could be because you don't have a good diet. There's lots of diet issues that could happen there. And I've also got another video on that, what is blood deficiency, that kind of explains a little bit about it, but not all of it. And then the other way for women is through the cycle, like they could have very heavy periods, or like a lot of bleeding, or bleeding between the periods. I've had some patients where they basically would bleed for 3 weeks, or a period that doesn't stop, that kind of stuff. Like, so abnormal uterine bleeding, that's called. Yeah, so Giovanni says here, the liver's function of storing and regulating blood volume indirectly influences our resistance to external pathogens. So if you have, like, the fundamental tenets of health is your sleep and your diet. So if those things are out of balance and you get blood deficient, then it means that your body doesn't have a good resilience to the environment. Now, what happens in a classical Chinese medicine sense, we would think of this as like your Shui Yin is like affected, so it's weak basically, and there's a big relationship between wind and blood. So having enough blood, or good quality blood, makes our body like more strong, more resilient to wind. So people who are blood deficient tend to dislike the wind. They don't feel happy in the wind, right? So if you blast them with a nice big fan, they're not going to feel comfortable like that. Or they go out on a boat and they'll be like, oh, let me inside, I don't like the wind. That's more likely to be a blood deficient person than, if someone's got stronger blood, they tend to not be as bothered by the wind. And the external environment is the first thing in Chinese medicine we think is like causing us to get sick, as in terms of cold and flu. So that's another video of how that happens. But it's an inability of our body to cope with the environment. So what we're getting at is people that are blood deficient have a less ability to cope with the wind, particularly wind, and they don't like that. And so that relates to in a TCM Zhang Fu sense, that's the relationship between liver blood and lung qi. A patient comes in with like what you would consider lung qi deficiency, like they'll say, oh, I just get sick at the drop of a hat, like just keep getting sick all the time. Rather than as a herbalist just going, well, we got to strengthen that lung qi and give them like Yu Ping Feng San or something like that, and like strengthen that resistance. Well, why is that lung qi weak? Maybe because it doesn't have a good, your body doesn't have a good underpinning background of blood, like it needs that blood. And how would you know that that's the case? Well, it's going to be by their pulse diagnosis mostly. and some of the symptoms that you get from that.
You've been listening to the Chinese Medicine Podcast with your host, Marie Hopkinson. If you like this video and you want to watch more, you can click on the link below to go to YouTube and watch the full episode there. You can also find our podcast on Apple, Spotify, and all places where you listen to audio podcasts. I look forward to seeing you again on the next video soon.